Echocardiogram is an ultrasound imaging of the heart. Ultrasound is high frequency sound wave which is not audible to the human ear. The machine sends out ultrasound beams intermittently to the heart and listens for the echo. Computer synthesized images are then produced from the images received from various parts of the heart. It is similar to the location of the aeroplanes in the sky by a radar system. The ultrasound signals are sent and received by a probe placed on the chest in specific locations. This is an echocardiogram showing all four chambers of the heart and two valves between the upper and lower chambers. The view is from the lower part of the heart and appears upside down. Here are the two lower muscular chambers, right and left ventricle. Now the upper chambers, right and left atrium, have been marked. Opening and closing of tricuspid valve on right side and mitral valve on left side have been marked here. Tricuspid valve is between the right atrium and right ventricle, and the mitral valve between the left atrium and left ventricle. Here the valve between the two lower chambers, interventricular septum, has been marked. The valve between the two upper chambers is known as the interatrial septum. Doppler imaging is by analyzing the echoes of the ultrasound beam from the moving red blood cells. You will be familiar with the difference in the sound of a moving train when it comes towards you and when it moves away from you. The same principle is applied in Doppler echocardiography. Signals from blood moving away from the probe is color-coded blue, and that moving towards the probe is color-coded red. This color Doppler shows downward movement of blood in the largest blood vessel of the body known as aorta. As the probe is kept in the upper part here, the downward flow in the aorta is color-coded blue.
Echocardiogram is an image of the heart using ultrasound. An ultrasound beam is transmitted into the body using a device known as transducer. The echo received from the body is processed by the computer in the machine to give an image of the heart. Transesophageal echocardiogram or TEE test is obtained by introducing a special type of transducer called a TEE probe through the throat into the food pipe, esophagus, and stomach. Usual echocardiogram is obtained by placing the transducer or probe on the chest. Lungs may overlap the heart intermittently while imaging the heart from the chest wall. This is because the lungs cover part of the heart when you breathe in. This will interfere with the image quality. In TEE, as the echo probe is in the food pipe, there is no interference by the overlapping of lungs. Esophagus or food pipe is just behind the heart, so that the distance which the ultrasound beam has to travel to reach the heart is also small. For both these reasons, the images obtained by TEE has much superior quality compared to external imaging. TEE is very useful in picking up small clots and infective material on heart walls. This helps in treatment of potentially life-threatening diseases like infection of heart walls. It can detect defects in the wall between the upper chambers of the heart known as ASD very well. TEE is widely used by heart surgeons to get real-time assessment of the heart after repair of birth defects and abnormalities of heart walls. As it can be done from the operating theatre itself, surgeon can immediately correct any residual defects before coming out of anesthesia. Usual echocardiography with probe kept on the chest is difficult during open heart surgery as the chest wall is open. Using a device over the open chest is likely to affect the sterility of the procedure and lead to contamination and infections. But there is no such problem with TEE as it does not interfere with the operating field. The imaging is from the foot pipe behind the heart. Now, is there any disadvantage for transesophageal echocardiogram? The most important disadvantage is the semi-invasive nature. Some feel it uncomfortable to have the long probe introduced through the throat. This can be reduced by giving sprays and application of local anesthetic gel. Those with obstructions or diseases of the foot pipe can have complications when the device is introduced. So the operator should be well trained in the procedure and in interpretation of the images. Supporting personnel to monitor the patient during procedure is also necessary. Echocardiogram, often called just echo in short, is ultrasound imaging of the heart. Though the actual types and details mentioned in echo report may vary between institutions and even persons reporting it, in general there are several common aspects. Reports of children with birth defects of the heart will have a different pattern. This discussion is mainly on an echo report from a general cardiology setup rather than a specialized report. In addition to details of identification and date of procedure, reason for the test and the quality of images are usually mentioned in the beginning of the report. Quality of images may be poor in those with lung disease and in obese individuals. Finer details in the report should be interpreted with caution when the image quality is reported as poor or as poor echo window. Chamber sizes and measurement of thickness of chamber walls are either given as tables or the relevant picture showing the measurements printed on the report. In some reports, reference normal values are also provided. While looking at reports of children, measurements should be interpreted considering the physical size of the child, as heart chambers grow in size as the child grows. In addition to the measurements, there will also be a qualitative report on whether the chambers are enlarged or thickened and whether they are contracting well or not. An enlarged heart chamber is mentioned as dilated, while a thickened one is mentioned as hypertrophied. The important chambers are the thin-walled upper and lower chambers known as right and left atrium, and the thicker lower chambers known as the right and left ventricle. The walls between the chambers are the tricuspid wall between right upper and lower chambers and mitral wall between left upper and lower chambers. Aorta is the great vessel carrying oxygenated blood to the body arising from the left ventricle. Pulmonary artery carries blood to the lungs for oxygen enrichment from the right ventricle. The valve between the left ventricle and aorta is called aortic valve, and that between right ventricle and pulmonary artery, the pulmonary valve. The great veins returning blood from the body to the heart are the superior vena cava from the upper part and inferior vena cava from the lower part. Both join the right atrium. Blood returning from the lungs after oxygen enrichment reaches the left atrium through the pulmonary veins. Pulmonary means in relation to the lung. An echo report will mention about most of these structures and their abnormalities, any if found. While coming to function of the heart, the concentration is often on the left ventricle, which pumps blood to the whole body. An important value in the report is the ejection fraction. Ejection fraction is the fraction of the blood from the full left ventricle which is ejected out during each contraction. Suppose after filling, when the left ventricle relaxes in diastole, it has 100 ml of blood. If 70 ml is pumped out by the next contraction or systole, the ejection fraction will be 70%. An ejection fraction below 50% is considered below normal. The lower the ejection fraction, the poorer the pumping function of the heart. A normal left ventricular ejection fraction is usually reported as good left ventricular function. If it is severely impaired, it is noted as severe left ventricular dysfunction. When the left ventricle is stiff and relaxes poorly in diastole, it is reported as left ventricular diastolic dysfunction. Left ventricular diastolic dysfunction is quite common as age advances. Another important aspect is the contraction of each region of the left ventricle. If all regions of the left ventricle contracts normally, it is reported as no regional wall motion abnormality. If a particular region contracts poorly, it is reported as hypokinetic. A region which is not contracting at all is reported as akinetic. Sometimes a region might bulge out when all other regions are contracting. Such a region is called dyskinetic. Regional wall motion abnormalities are common after a heart attack. When a blood vessel supplying a region of the heart muscle is blocked, that region shows a regional wall motion abnormality of any of the above mentioned types. Sometimes a birth defect may be present in the walls separating the heart chambers. A defect in the wall between the upper chambers is called an atrial septal defect. Ventricular septal defect is noted in the wall between the lower chambers. Any of the heart valves can also be abnormal, either as a birth defect or acquired later in life due to diseases. If a valve is narrowed, it is called stenosis. There can be mitral stenosis, aortic stenosis, tricuspid stenosis, and pulmonary stenosis, or a combination of these. Leak in a valve is called regurgitation. So, there can be mitral regurgitation, aortic regurgitation, tricuspid regurgitation, and pulmonary regurgitation, or a combination of these. There can also be stenosis and regurgitation in the same valve. Stenosis can be graded as mild, moderate, and severe depending on the severity. Area of the narrowed valve may be mentioned in certain cases. Regurgitation can be graded as trivial, mild, moderate, and severe. Trivial regurgitation, as the name implies, are usually ignored, especially in relation to the right-sided valves, pulmonary and tricuspid. Pressure gradients across the valves will be mentioned when the valve is narrowed. The gradient increases as the severity of the narrowing increases. When there is a leak in the tricuspid valve, the pressure difference between the right ventricle and right atrium can be calculated. This is usually mentioned as TR or tricuspid regurgitation gradient. Usually, a nominal value of 10 is added to this gradient and mentioned as the estimated right ventricular systolic pressure or RVSP. An elevated RVSP implies increased pressure in the pulmonary artery known as pulmonary hypertension if the pulmonary valve is not obstructed. Thickening and distortion of valve leaflets is common in diseased valves and may be noted on echo reports. Sometimes the number of leaflets may be abnormal. For example, the aortic valve usually has 3 leaflets. If it has only 2 leaflets by birth, it is called bicuspid aortic valve. If there is fluid collection between the covering layers of the heart, it is reported as pericardial effusion. The estimated amount of the collection will be reported as mild, moderate, or large. Gross thickening of the outer covering of the heart may occur in a condition known as constrictive pericarditis. Infective material attached to valves are called as vegetations. Clots attached or floating in the heart chambers are called thrombus in singular and thrombi in plural. Occasionally, tumors or other masses may also be noted inside the heart chambers. After the descriptive report and the measurements, the final conclusion is usually reported at the end of the report. In case of a normal adult study, it may read as no regional wall motion abnormality, good left ventricular systolic function. Regional wall motion abnormality may be written in short as RWMA also. If abnormalities have been detected, the conclusion part will be larger and include the salient parts of the echo study. For example, in a person with a defect in the wall between the lower chambers, it may read as congenital heart disease, large perimembranous ventricular septal defect, left to right shunt, moderate pulmonary arterial hypertension, good biventricular function. This would mean that there is a large defect in the upper part of the wall between the two lower chambers and blood is leaking from the left ventricle to the right ventricle across the defect. The pressure in the blood vessels of lungs have gone up due to the increased flow, but the pumping function of both right and left ventricles are normal. Thank you for watching this video. Please subscribe, like, share and post your valuable comment below this video.